Neuropsychology is a fascinating field. It explores the intricate relationship between the brain and our behavior. Think of the brain as a vast, intricate network. By doing so, we gain valuable insights into what makes us who we are. The brain is the command center of the human body. Neuropsychology aims to unravel the mysteries of this powerful organ. The human brain is an incredibly complex organ. It's a network of billions of neurons, all communicating with each other. Different areas of the brain are responsible for different functions. For example, the frontal lobe plays a key role in planning and decision-making. The temporal lobe is involved in memory and language. Neuropsychology focuses on understanding these connections. It examines how the different parts of the brain work together. It also looks at what happens when these connections are disrupted. Imagine the brain as an orchestra, with each section of instruments contributing to the overall harmony. The frontal lobes act as the conductors, orchestrating our thoughts and actions. The temporal lobes, like the string section, weave together our memories and language. The parietal lobes, resembling the percussion, process sensory information and spatial awareness. Just as a conductor guides the orchestra, neuropsychologists strive to understand how different brain regions collaborate to create the symphony of human behavior. Neuropsychology helps us understand how brain function translates into behavior. For instance, damage to the hippocampus, a small structure deep within the brain, can lead to memory problems. People with damage to this area may have difficulty forming new memories. This knowledge is crucial for diagnosing and treating conditions like Alzheimer's disease. By studying individuals with brain injuries, neuropsychologists have been able to map out the functions of different brain regions. For example, Phineas Gage, a railroad worker who survived a traumatic brain injury in 1848, provided early insights into the role of the frontal lobes in personality and executive function. Neuropsychological conditions can arise from various factors. These include traumatic brain injury, stroke, or neurodegenerative diseases like Alzheimer's. These conditions can manifest in a variety of ways. They can affect memory, attention, language, and even personality. One example is a stroke. A stroke occurs when blood flow to a part of the brain is interrupted. This can damage brain cells and lead to a range of problems. These can include difficulty speaking, paralysis, or problems with vision. Another example is dementia, a general term for a decline in cognitive function. Alzheimer's disease is the most common type of dementia. Traumatic brain injury, often resulting from accidents or falls, can disrupt the brain's delicate wiring, leading to challenges with attention, memory, and emotional regulation. The impact of these conditions extends beyond the individual, affecting families and communities. Neuropsychology steps in to provide answers, support, and strategies for coping with these challenges. These conditions highlight the critical importance of protecting our brains. Wearing helmets during sports, preventing falls, and maintaining a healthy lifestyle can all help to reduce the risk of neurological problems. Decoding the mind tools of a neuropsychologist. Neuropsychologists use a variety of methods to assess and diagnose these conditions. One of the most important tools is the neuropsychological evaluation. This involves a series of tests and assessments. These measure a person's cognitive abilities, such as memory, attention, and problem-solving skills. Neuropsychological assessments are like puzzles, piecing together clues about an individual's cognitive strengths and weaknesses. Through carefully designed tests of memory, attention, language, and problem-solving, neuropsychologists gain a comprehensive understanding of how the brain is functioning. Imaging techniques, such as MRI and PET scans, are also crucial. These scans allow doctors to visualize the structure and activity of the brain. They can help to identify areas of damage or dysfunction. For example, an MRI can reveal the extent of brain damage after a stroke. Beyond these technological marvels, neuropsychologists rely on their keen observation skills and clinical judgment. They carefully listen to patients' stories, observing their behavior and interactions, to gain a holistic understanding of their cognitive and emotional state. The healing touch treatment in neuropsychology. Treatment for neuropsychological conditions varies depending on the specific diagnosis. However, it often involves a combination of approaches. These include medication, cognitive rehabilitation, and psychotherapy. Medications may be prescribed to manage symptoms such as depression, anxiety, or sleep disturbances, which are common after brain injury. Cognitive rehabilitation focuses on helping individuals regain lost cognitive function. This may involve exercises to improve memory, attention, or language skills. Psychotherapy plays a crucial role in helping individuals and their families adjust to life with a neuropsychological condition. It provides a supportive space to address emotional challenges, develop coping mechanisms, and enhance overall well-being. Neuropsychologists work closely with other healthcare professionals. These include neurologists, psychiatrists, and physical therapists. This collaborative approach ensures that patients receive comprehensive and coordinated care. Beyond the clinic, the wider impact of neuropsychology. Neuropsychology's influence extends beyond the realm of clinical practice. It informs educational strategies, shapes legal proceedings, and enhances our understanding of human behavior in various fields. In the courtroom, neuropsychologists provide expert testimony on cases involving brain injury, helping juries understand the cognitive and behavioral consequences of such injuries. Their expertise assists in determining legal responsibility and appropriate compensation. In the field of education, neuropsychological insights are used to develop effective teaching methods tailored to different learning styles. Understanding how the brain processes information helps educators create engaging and accessible learning environments. Neuropsychology also plays a vital role in shaping public policy. By providing evidence-based research on the impact of brain injury and disease, neuropsychologists advocate for better healthcare policies, improved access to treatment, and increased funding for research. A window to ourselves. Why neuropsychology matters. Neuropsychology is a vital field that provides a unique window into the human brain. By understanding the connection between the brain and behavior, we can better diagnose, treat, and prevent a wide range of neurological conditions. Learning about neuropsychology empowers us to take better care of our brains. We can make informed decisions about our health and well-being. It encourages us to appreciate the remarkable capabilities of this complex organ. Neuropsychology fosters empathy and understanding for individuals living with neurological conditions. By recognizing the challenges they face, we can create a more inclusive and supportive society. Neuropsychology is a journey of discovery that deepens our understanding of what it means to be human. It's a field that will continue to shape our lives and our world for years to come.